In this video, we're going to go over the concept of TART. And this is something that is fundamental in OMM, and it really comes up again and again. So we're just going to go over what each of these letters mean, why it's used, and we're going to go over how TART presents in the acute or the chronic setting. So first of all, what is TART? Why are we even talking about TART? This is a term that's really important in OMM because it helps us break down diagnosis of a somatic dysfunction. And so that's the first step. For example, when you're billing for OMM in the hospital, you have to have a formal way of writing down the diagnosis, and so you can write down somatic dysfunction. And this helps you kind of organize where the somatic dysfunction is coming from, and it helps you to direct what your treatment is going to be. So first you start with tissue texture changes. And tissue texture changes is basically what the name implies. It's just what you feel on the skin. And if it's something that's acute, and this is something that's commonly tested, just a couple of terms that you have to understand. If it's acute, so it hasn't been there for too long, what you'll commonly see is edema or bogginess or moisture or a hypertonic muscle tone. I don't think hypertonic muscle tone is necessarily something you should remember, but it's just to kind of paint the picture. But if it's there for a long time, if it's in the chronic setting, what you'll commonly see is a fibrotic or a ropey feel. And so that makes sense. Fibrosis takes a longer time, therefore the tissue texture changes of fibrotic or ropey changes is something that you're going to see in the chronic setting. Next is known as asymmetry, and asymmetry is also very intuitive. In the acute phase, it's just there. And so you don't have any other compensation. Remember, whenever you have an issue with the body, if the body can, it's going to react and it's going to try to make it better in the best way that it can. And so acutely, it probably doesn't have time to accommodate or compensate for the issue. But in the chronic phase, you still have that asymmetry, however, you have some compensation in other parts of the body. In the case of asymmetry, one side may be more prominent than one another, one side may be higher than one another, and it's something that you can discover upon palpation. Next, and this is a different video where we talked about restriction and the types of restriction that we're looking for. But in this case, when we're discussing it in terms of acute and chronic phase, the difference is in the acute phase, we do see a restriction. So we have some kind of like restrictive barrier, otherwise known as pathologic barrier. We have some kind of motion restriction that's not normal. And in the acute phase, you have some pain with the movement. So if someone tries to move all the way to one side and can't move to the extent of their normal range of motion and they have pain, and that's what's described to you on a question stem, then that's going to be an acute restriction. Now, let's say someone had a restriction, you couldn't move all the way to your regular physiologic barrier, and if you didn't understand what physiologic barrier is, there's a short video on physiologic barriers. And let's say they had a restriction, but they had no pain. That would be a chronic restriction that's been there for a long time. And that might help choose, for example, a treatment that might be better for a chronic restriction than acute restriction. And finally, the last part of TART is tenderness. And tenderness in the acute phase would just be some sharp kind of pain. Or in the chronic phase, the pain can be described as dull or burning. It's similar to differentiating visceral pain and somatic pain. Visceral pain being dull and burning, and the somatic pain being sharp. And that's kind of the same difference here in acute versus chronic. Now, the last thing that I would mention is you can have any one of these in a patient to diagnose a somatic dysfunction. So if you ever, in the hospital, if someone's trying to treat a patient and they're billing the insurance, they can say patient has a somatic dysfunction, asymmetry, at and they can give them some more details. But you just need one of these to make a diagnosis.